Rồi, task 4. Okay, let's move to session 3. Session 3 on for the last part of chapter 6 for the reading. A passage about nervous disorders, cerebral palsy. So what is cerebral palsy? Signs and symptoms and the treatment. Now watch a video clip and discover the information about this kind of disease.
What is cerebral palsy? For most parents, when they receive a diagnosis of cerebral palsy for their child, they experience confusion and strong emotions. There are often more questions than there are answers. Every parent searches for the best way of supporting their child. We know that each child with cerebral palsy is unique, and every child can be supported to fulfill their individual potential, goals, and aspirations. There are many interventions or supports that can help reduce the impact of cerebral palsy on the body and improve the individual's quality of life. Here, Prue Golland talks about cerebral palsy, what it is, how it is caused, and how it is generally described. Prue is our senior physiotherapist and has more than 10 years' experience working with people living with cerebral palsy and their families.
Cerebral palsy is an umbrella term for a group of disorders that affects a person's ability to move. This means that not everyone with cerebral palsy looks the same. There is a meaningful future for every child, adolescent and adult living with cerebral palsy. For every person, there is a positive way forward through treatment and support provided in partnership with individuals and their families. Cerebral palsy is caused by an injury to the brain that usually happens during pregnancy, but sometimes it may happen shortly after birth. Cerebral palsy affects people in different ways because different parts of the brain can be injured. However, it always has some impact on the person's movements, and this is because the messages coming from the brain to the muscles are affected. Cerebral palsy is the most common physical disability in childhood, with 1 in 500 children born in Australia each year. One of the first questions parents ask is, why does my child have cerebral palsy? For many parents, the answer to this question is not straightforward. In fact, for most children, the cause of cerebral palsy remains a mystery. How any individual baby sustains a brain injury is often difficult to work out. A great deal of research is happening in this field, and what we currently know is that there are a number of risk factors that alone or in combination may result in injury to the brain. The most significant of these include prematurity, when babies are born less than 37 weeks, and babies who are born with low birth weight, and this sometimes happens with twins or triplets. Other factors may include the presence of blood clotting problems for either the mother or baby, or problems with the placenta during pregnancy. Some bacterial and viral infections such as German measles may also be contributing factors. Contrary to what was believed for many years, lack of oxygen at birth plays a part for only a very small percentage of infants with cerebral palsy. In babies who acquire cerebral palsy after 1 month of age, stroke is the most common cause. I am often asked if cerebral palsy is genetic. Unlike Down syndrome, for instance, researchers have not identified a gene that directly causes cerebral palsy. Rather, they now believe that a genetic predisposition to certain risk factors may be part of the picture. In other words, a genetic condition, such as blood clotting disorder or heart problems, may result in an event or series of events that, when combined, can cause or increase the risk of injury to the developing brain. Cerebral palsy can be diagnosed at any time from birth, with the average age for diagnosis being 18 months. For some infants, their movement difficulties will be seen very early on. For other children, these difficulties may not be clear until they are a little older, and it becomes clear that they are not progressing like other children of the same age. Some of the signs that indicate a baby or child may have cerebral palsy include they feel floppy when they are picked up, they cannot hold up their head, they have muscles that are stiff, or they display unusual postures with their body. And for a lot of children, sometimes their developmental milestones such as rolling, sitting up, walking and talking are delayed. As I mentioned earlier, cerebral palsy affects people in different ways, and this is largely due to the location of the injury in the brain. Therefore, cerebral palsy is described in a number of ways, including the parts of the body affected and the way in which it affects movement. Where the whole body is affected, that is, both arms and legs and the trunk, this is called quadriplegia. Where both legs are mainly affected, this is called diplegia. People with diplegia often also have difficulties with fine movements of their hands. When one side of the body is affected, for example the left arm and the left leg, this is called hemiplegia. The next way of describing cerebral palsy is to talk about the way it affects movement and the type of movement difficulties experienced by people with cerebral palsy. Spasticity is probably the most commonly known term. Spasticity is present in about 86% of people with cerebral palsy. It results in muscles that become stiff and tight, which can make it difficult for someone with spasticity to use their muscles easily. It is difficult for someone with spasticity to turn their muscles on and off when they want to. This makes it difficult for them to move their arm or leg to do a task, or to use their mouth and face muscles to eat and talk. Some people have a little bit of spasticity, other people have a lot. The impact of spasticity on movement will therefore vary enormously between individuals. You might also have heard the terms dystonia or athetosis. Dystonia and athetosis describe movements seen in dyskinetic forms of cerebral palsy. Dyskinetic or dyskinesia refers to movements that are involuntary. These involuntary movements can become more noticeable when a person tries to move or when they become excited, agitated or tired. Dystonia results in unusual twisting postures, repetitive movements, or sometimes both. Dystonia can present in one part of the body, such as an arm or foot, or throughout the whole body. With athetosis, we see slow, continuous, involuntary writhing movements that are present at rest and made worse by attempts to move. Around 6% of people with cerebral palsy have dyskinesia, with dystonia more common than athetosis. One of the less common forms of cerebral palsy is ataxia. Ataxia means without order or incoordination. Ataxic movements are characterised by clumsiness, imprecision, or instability. Movements are not smooth and may appear disorganised or jerky. The incoordination seen with ataxia occurs when a person attempts to perform voluntary movements such as walking or picking up objects. Ataxia causes an interruption of muscle control in the arms and legs, resulting in a lack of balance and coordination. Sometimes people have a mixed type of cerebral palsy. For example, some people have both spasticity and dystonia. Knowing what type of cerebral palsy your child has will help you, your family, and the people who support you to understand your child's unique needs. Your health professionals will be able to conduct an assessment to identify if spasticity, dyskinesia, or ataxia is present and how this impacts on movement. There is a positive way forward for every individual with cerebral palsy. There are many interventions or supports that can help reduce the impact of cerebral palsy on the body and improve the individual's quality of life. Interventions are varied and serve different purposes. Some interventions help to establish new skills. Some modify the task demands to support the child's performance. Some techniques alter the environment to increase success, while other interventions aim to prevent secondary impairments from occurring. Some interventions are targeted towards a particular type of cerebral palsy. Therapists at Cerebral Palsy Alliance can help you to make sense of the interventions that might help your individual situation. Other questions that I am frequently asked by parents include, will my child walk and will my child talk? One way of helping to answer these questions is to be guided by a number of categories of cerebral palsy that are based on functional abilities. The first of these is the GMFCS, which stands for Gross Motor Function Classification System. This looks at whether a person is likely to walk independently or will need a wheelchair. The second is the MACS, which stands for Manual Ability Classification System. The MACS identifies how much assistance someone might need using their hands. The last category is the CFCS, which stands for the Communication Function Classification System. This looks at how people with cerebral palsy communicate with others. These three classification systems are explored in more detail on our website.
Okay, look at some vocabularies found in the reading message about cerebral palsy. Acquired cerebral palsy. A type of cerebral palsy characterized by involuntary movements, fluctuating muscle tone, ataxia, a lack of muscle coordination affecting the voluntary movements. Ataxia. People with ataxia struggle with balance and precise movements. Ataxic cerebral palsy affects the balance and coordination. Children with ataxic cerebral palsy often have difficulty walking in a straight line. Basal ganglia, a group of structures in the brain that help control movement. Damage to the basal ganglia can cause movement disorders. Bilirubin, a yellow pigment found in the bile, causes jaundice when present in high amounts. High bilirubin levels in newborns can lead to brain damage and cerebral palsy. Botulinum toxin or Botox, a substance used to relax muscles and reduce spasticity. Botox injections have reduced muscle stiffness in cerebral palsy patients. Cerebellum, cerebral cortex. Phần section 1 mình đã học ở các phần bộ não và mình nói vào phần này rồi ha. Cerebrum, cerebellum, encephalon, brainstem, different parts of the brain. In section 1. 9. Cerebral hemorrhage, a bleeding in the brain lead to brain damage.
70 tỷ của Trần Thành. Năm máy thiết kế riêng đảm bảo không chạm mặt hành xăm, giá vốn bãi đậu siêu xe buýt, một bơi với tiêu thành thành phố.
Cerebral hemorrhage during birth increases the risk of cerebral palsy.
Nếu sống lại thì xác suất để bạn gặp họ thì là thấp vì bạn sẽ không liên tục thang máy và tình nguyện tự nâng cao những cái dự án chuyên khoa tại Việt Nam. Đây là thuốc tiêm chẩn đoán sử dụng 100% các căn hộ đều thành VIP thì ở đây có một xe VIP sử dụng và trong
Number 10, cerebral palsy. 11, contracture. Condition where muscles and tendons become permanently tight. Physical therapy helps prevent contractures in children with cerebral palsy. Cortical spinal tract. A pathway in the nervous system controls voluntary movement. Damage to the cortical spinal tract affects motor function. Dysarthria. Dysarthria, the difficulty in speaking due to poor muscle control. Many individuals with cerebral palsy experience dysarthria. Ischemic cerebral palsy. A type of cerebral palsy causing involuntary movements. And ischemic cerebral palsy affects muscle tone and control. Extrapyramidal system, a network of brain structures control involuntary movements. Damage to the extrapyramidal system can cause dyskinetic cerebral palsy. Gait abnormality, difficulty in walking due to the muscle problems. And people with cerebral palsy often have gait abnormalities. Gross motor skills, large movement that involve the whole body. Walking and jumping are examples of gross motor skills. Hemiplegia. Hemiplegia. Paralysis affecting one side of the body. And children with hemiplegia have difficulty using one arm and leg. Hypertonia. Increased muscle stiffness. Hypertonia makes it difficult for patients to move freely. And hypotonia means decreased muscle tone, making muscles feel floppy. Babies with cerebral palsy may have hypotonia at birth. Intellectual disability. A condition affects the person's ability to think and learn. Some individuals with cerebral palsy may have an intellectual disability. Intraventricular hemorrhage. Bleeding inside the brain's ventricles. IVH. Intraventricular hemorrhage. IVH in premature babies can lead to cerebral palsy. Motor cortex, the part of the brain that controls movement, and damage to the motor cortex cause movement difficulties. The motor neurons, the nerve cells that control the muscle movement. Muscle spasticity, a condition where muscles remain stiff and difficult to move. Muscle spasticity is common in children with cerebral palsy. Neonatal hypoxia, a lack of oxygen to the brain at birth. Neonatal hypoxia is a leading cause of cerebral palsy. Neurodevelopmental disorder, a condition affecting brain development. And cerebral palsy is classified as a kind of neurodevelopmental disorder. Neuromuscular therapy, a treatment focused on nerve and muscle function. Neuromuscular therapy helps to improve the movement control. Occupational therapy, OT, the therapy that helps people perform daily tasks. Occupational therapy teaches children how to dress and eat independently. Paralysis, loss of ability to move certain muscles. Pediatric neurologist, a doctor who specializes in brain and nerve disorders in children. Physical therapy, or PT, a treatment that improves movement and flexibility. Postural control. Postural control means to maintain the balance and posture. Quadriplegia. Quadriplegia means a paralysis affecting all four limbs. Quadriplegia. Reflex abnormality, unusual or excessive reflex reactions. Rồi chúng ta đọc bài và chúng ta làm cái bài tập trong giáo trình trước ha. Thì chúng ta tham khảo một số những cái ý chính có trong bài. Definition and the cause of cerebral palsy. It's a disorder of postural movement caused by damage to the brain. Can occur before, during, and shortly after birth or early in childhood. Causes may be multiple and complex, include infection during pregnancy, oxygen deprivation, brain bleed, difficult or multiple birth, abnormal brain development, and genetics. Premature birth is a major risk factor, and some other causes include maternal infections, carnivorous, or high bilirubin levels. Time of cerebral palsy. Spastic cerebral palsy causes muscle stiffness or hypotonia and restricted movement, results from upper motor neuron damage. Epileptoid or dyskinetic cerebral palsy involves involuntary movements and mixed motor tone, fast speech and muscle control, linked to damage in basal ganglia and motor systems. Ataxic cerebral palsy, fast balance and coordination caused by damage to the cerebellum. Cognitive impact. About 70% have some mental impairment. Others may have normal and high intelligence. Speech difficulties may lead to misconception of low intelligence. Diagnosis. It may not be diagnosed until after the first year. There are some early signs like muscle slackness, feeding difficulty, delayed sitting, or birth defects. Treatment and management. Although there's no cure for the disorder, but therapies can improve function and quality of life. Physiotherapy, speech therapy, assistive devices, and non-verbal communications methods. And Botox injections may reduce the muscle spasticity and pain. Early intervention, especially in the neonatal intensive care unit, improves outcomes. Slight increase in cerebral palsy diagnosis in recent years. Better neonatal care improves survival, and low birth weight babies are at higher risk. Là phần section tree trong giáo trình ta có 3 class nên class 1, class 2, class 3. Từ trang 104 đến trang 106. Rồi. More practice for section 3 for the reading. Class 1 vocabulary. MCQ questions. Choose the best answer. related to the vocabulary in the message. As to true or false sentences. That's true.